Atrial fibrillation and mitral regurgitation. What happens in patients and how to prevent?
Well, the patient present with atrial fibrillation and severe mitral regurgitation. That could be having two kind of presentation. One is acute severe MR, which atrial fibrillation would be one of the components, but the critical part is still the management of the acute MR. And the other presentation would be atrial fibrillation complicating chronic severe mitral regurgitation. And that would depend on patient presentation and the etiology of the mitral regurgitation and to guide us with a different kind of management. For the former part, when there's an acute mitral regurgitation, the patient needs to be stabilized emergently. This is a surgical emergency. So once we could stabilize the patient with intravenous vasodilator and also with supplemental oxygen support, diuresis are needed, sometimes may need intra-aortic balloon pump, then the patient should be sent for the emergency surgery. And if they could be initially stabilized, the timing of surgery could be determined by the hemodynamic status, but most of the patients will still require urgent surgery. For the second part is when the patient presents with atrial fibrillation complicating chronic severe mitral regurgitation. Depending on the etiology, the most common cause will still be the degenerative mitral valvular disease, and those patients would, after medical treatment, should favor early mitral valve repair.
And what about atrial fibrillation after surgery?
Now, atrial fibrillation is quite common after surgery, especially cardiac surgery, and most of the time it will be self-limiting. However, it definitely increases the mortality and also the risk of stroke postoperatively. So we try to give the patient perioperative prevention with beta blocker or amiodarone to reduce the occurrence of post-op atrial fibrillation. And long-term wise, when they develop that, one may need to consider long-term anticoagulation too.